Hi everyone, welcome to Sonographers in the Cities. I'm Lynn.
And I'm Giselle.
We hope you had a great first week of May and thank you so much for tuning in to this episode.
We are here to start off a brand new month with a topic that I think is going to be very popular for you guys, and that's how to choose between different specialties, and that's vascular, echo, and general. So a lot of you guys who are in school or, going to choose this career, you have to choose kind of which route you want to go. And so we're going to talk about that today. So thank you guys for tuning in to another episode. We have a lot of information that we hope you guys find helpful. And if you guys have any questions, don't forget to ask us, comment below, or message us on Instagram.
Yes, so before we get started, we'll do a quick recap of how we chose our specialties. So Giselle, how did you choose your specialties?
So I actually if you guys know my story, I just kind of fell into ultrasound, but my program actually does both general and vascular. So I just kind of obviously didn't really get to choose if I wanted to do echo or vascular or general. I just kind of fell into it. However, that program there, that's a bachelor's degree, it's general and vascular. And then there's another school here in Nevada, in Las Vegas, more specifically, that does echo, and echo is a separate track on its own. So I am a general vascular sonographer, and it's a little bit different than, like, I'd say the East Coast would be, because all schools decide whether they have vascular, echo, or general in their program. And so it's kind of confusing at first, especially if you're new to the whole ultrasound world. And so that's why we're going to dive in about these different general registries and things like that and specialties. But everyone always asks me like, "Oh, if I scan babies, is that the only thing I scan?" And no, that's not the only thing I scan. So, as a general sonographer, I do a lot of different things. And so I didn't get to choose it, but I love what I do. And now that I look at it and I have the experience I do now, I can help you guys decide whether or not you want to do echo, vascular, or general. Why did you go the echo route?
When I first, if you haven't heard my story on like Giselle's YouTube video way back when,
Mm.
I started with general because the reason I went to ultrasound was my dad, and he had his abdomen scanned. So I was like, okay, I'm gonna do general. That's what I said for my interview. And then I connected with my friend Christy, who was a guest on this podcast. She was ecovascular. I met her at school because, we connected through Instagram, met her at school before orientation. And I'm like, oh, ecovascular sounds fun. So I changed it last minute, the day of orientation. So I missed the general orientation and jumped right to ecovascular. Without the only thing I knew was that it involves the heart and the vascular system.
Mm.
And the more as I learned, the more I started my program, dive into it. The more I learned about ecovascular, I was really interested. I loved it. I loved learning echo. I'm not so sure about vascular because the hemodynamics was really hard to learn at first. And now it's just with clinicals, I love it even more. So like the more I do it, the more I fall in love with it.
That's good. Yeah, it's definitely I remember you talking about when you were deciding to switch actually. But it's what is it about the heart that you really enjoy scanning?
I just love it, fascinates me. Like the brain and the heart fascinates me because it's just one organ that does so much and so vital to us being able to live and function, so being able to scan and see how it pumps in real time, and the fact that as you learn, you can actually see like how hard it's working or how what's wrong with it. So with echo, what you do is like you scan different views. There are different views, you can evaluate different parts of the heart, and what you also evaluate the valves of the heart. So it's just one organ, but it's super duper complicated. So the amount of information that was taught is really, what's that word? I want to say concentrated, because it's so much in a short amount of time, and all there's so many pathologies that you can learn, including congenital as well. So that's why there's like adult echo and fetal echo and pediatrics, because the heart, when you're in fetal life, is so different when you're in a child and when you're an adult. So it's just one single organ. It's so complicated and it affects everything else. It also affects the vascular system, because what you see when you Doppler in an artery or a vein, that's from the heart. So I just really love how it affects everything else. And then there's studies that you can do to um, see how hard the heart is working, like a stress test, the butamine test, and there's bubble studies to see if there's PFO, which is pain, foramen, or valley. So that's when like the hole between the right atrium and the left atrium didn't close. It's just so fascinating. There are so many pathologies in the heart that could, that is there in the heart. But sometimes as I learn it, I'm just like, how is it possible that my heart is normal? Because there's so many things that could happen. That's just a quick recap of the heart.
Yeah, no, I only asked because obviously we're going to start talking about echo first because
Mhm.
we've got echo, vascular, and general sonography. And those are the three routes people can do. I know nothing about echo, and I want to pick your brains a little bit because I know you are so fascinated by it. And that will help only other people become more fascinated by it because a lot of times us general sonographers, I guess the main question would be to you is, does it ever get boring just scanning the one organ, right? And a lot of times when I see on Facebook and other sonographers decide why they went through general or why they picked general, a lot of the reasons being were, oh, it's very diverse, there's a lot of different things you can scan, every day is different. And I think you kind of answer that question, by saying that there's a lot of different pathologies with the heart. It's so intricate. There's so many things you can find, so many different abnormalities, and everyone's heart is different. Just like how the body, everyone has the same organs inside their bodies, but the makeup is a little bit different. So, what would you say to those people who are asking if scanning the heart only is boring?
It is definitely boring because the heart is, like I said, it's very complicated. Also, a disclaimer, I'm still a student, so what I know is what I've learned. So hopefully this will give you some information, some insight for you to maybe choose echo or rule out echo, but it is not enough information for you to know everything about echo, because I don't know everything about echo. We still don't know everything about echo because research is still going on, and medicine is always improving. But back to what you asked, I
So you're
just
saying
thought of something because
there's,
you
but you said it's not boring, right?
no, no, no.
Okay,
It
because I
it is
okay.
not boring. Because you said, like, people say that general is really diverse and all that stuff,
Mhm.
and which is funny because a lot of my classmates who love echo, they're saying that they love echo because it's just one thing and you just focus on one organ instead of going around the body and making it more complicated, even though
Mhm.
the heart is complicated. And also, like, everything you do affects the heart. I recently did a presentation because we had an assignment where we had to pick a topic relating to cardiovascular or echocardiogram to do. And after that assignment, where we had to present our project, I realized that everything we do affects the heart. Like, I did mine on cardiovascular complication of recreational drugs. So your daily habits, your if you do drugs, if you work out really well, it affects the heart, and you can see that when you scan the heart. So that's what I love about echo, because you can actually tell what the person's lifestyle habits is without knowing them by looking at their heart, or like what they have, or you can predict what symptoms they have by looking at the heart.
Wow, that's so cool. Yeah. I mean, I know nothing, absolutely nothing about scanning the heart. I do know the heart obviously is a vital piece to life, and it's obviously something that I think people need to be more aware of. I mean, I recently just found out that I have some heart stuff going on, and you would think that I'm a completely, obviously, healthy person. However, there is something functionality wise, it's okay, but the neurons and everything like that, it's not beating correctly
Mhm.
how it should. And so me going to get an echo is a whole new world because you don't think about it. Your heart just ticks and beats for you your whole entire life, and people don't realize the things that they do every day affects it. So it's really cool that you guys get to map that out and check out everything, every little bit of it, the valves, everything. I've seen you guys at work and it's really cool. So thank you for sharing more about
Yes.
echo.
Just a little quick interesting thing about echo too is like there are two ways to do ultrasound for echoes.
Mhm.
Is the one is transthoracic, which is the what we know of like scanning on our chest, transthoracic, and then the other one is transesophageal, which is goes to your esophagus. So it goes in and you can see the heart clearer, and
Wow.
that's like mostly for congenital or like valves evaluation if they
Mhm.
have like prosthetic or mechanical valves or any vegetations like endocarditis,
Mhm.
just to like be more accurate and stuff. So,
So
because
you guys do that?
I don't do it in my site
Mhm.
specifically, I've seen it, but in hospitals they do. If I have a site in hospital, hopefully I get to see, but
Mhm.
I haven't able to see it yet. But I
Yeah.
think it's really cool to learn.
Yeah, that sounds really cool. Because there's people don't even realize there are multiple ways you can see the heart. And so, like you said earlier, echo and the heart ties into vascular. Now, some places that you go to school, when you guys choose your schools, you have to see what their program offers. So if their program offers echo combined with vascular, majority of them do, I feel like, echo vascular together. But I'm going to give you an example. At my hospital, our echo department is completely separate from vascular because vascular and general are together. So I'm general, but I do general and vascular. In other states and hospitals, they have separate echo, separate vascular, separate general. So, like I said, you've got to figure out, first of all, where you're going to learn at your program, what they offer. And a lot of times people learn vascular on the job because some programs do not offer vascular and the majority of hospitals do vascular. So it gets confusing. And that's why I said if you have any questions, let us know. Vascular, since you haven't really said much about vascular, how would you describe vascular for you in general since like you are doing echovascular in your program?
For me,
And then I'll go into it on my
yeah,
end.
because you're a pro. For me, Echo, I learned didactic learning. Echo is easier, despite the amount of information that we had to learn. Vascular scanning was easier because arteries, veins, um, maximum velocity of each, and it's like it was a little bit hard to grasp at first because of how my curriculum is set up. But the more because I learned most of them on my site actually, my clinical site because I didn't.
Mhm.
So and I actually love scanning vascular now
Oh,
more than
very nice.
echo.
What? Why is that?
Like clinical sites really like kind of change what
Right.
you want to do or like how you learn and all that stuff. So I'm leaning towards vascular a little bit more only because I've been doing so much vascular studies at my current site and I'm still learning echo. So I'm not a proficient at echo, at scanning echo yet, but I'm doing tons of vascular studies at my current site. So I was able to understand it more, like do it faster, and it just comes a little bit more naturally now.
But that's the thing, it's like, remember how we talked about when you understand something a little bit more, you kinda like it a little bit more,
Yeah.
and you're scanning vascular more, whereas at first you weren't really scanning vascular. So and you can see how you feel about it. And for me, Venuses were the very first thing that I had gotten down as a sonography student. And so that's why I really like doing lower extremity Venuses. Now, I've worked with other people who hate doing vascular and hate doing lower extremity venuses, and I'm like, just give me all the legs or give me all the arms. So that being said, vascular does tie into the heart, just like Lynn said, and obviously your veins and your arteries are connected to your heart. They're the pathways from your heart. It's essential to be able to scan vascular and know what direction the blood flow is going, if it's really elevated, if there's a blockage, if there's thrombus, which is also known as a blood clot. Ultrasound is actually one of the top things that people get to look for a blood clot. And so, vascular is a huge department in a majority of hospitals, but also there's a lot of outpatient places because of those cardiovascular offices. As far as echo and vascular go, there's a lot of job opportunity, just like there is for general. People are worried that there's not. And I think that they have to think about their area and research that part. But as long as when you're choosing your route, echo, vascular, general, see what you like about each thing, because these are the things you're going to be scanning every single day. And just like Lynn said, now that she's scanning vascular a little bit more, she's kind of getting the hang of that and likes it a little bit more. And, how would you have known that before if you didn't scan it? So
Exactly.
yeah.
And like with vascular, one of the things I didn't like about it initially is that it's everywhere in the body. You're going from the brain to the neck to the extremities and the lower extremities, the abdomen, and like you have to know different types of waveforms, how and why it is the way it is, or why if it's like a abnormal waveform, and you have to understand why it's abnormal, like what's causing it in that specific spot of the artery or the vein. And it just makes you think a lot, like as you're scanning. It's like, oh, this is because, and you can, for me, I can visually see if there's like a stenosis, I could visually see, I was like, oh, it's because of this, or you know what I mean? Like it's,
Mhm.
you can kind of like, I can sometimes hear my brain working when I scan vascular. And I think
Yeah.
that's just really a good challenge and really cool.
And some people don't even realize that we're thinking in our brains when we're scanning. They think we're
Mm,
just taking pictures, but we're actually thinking, okay, what's happening?
mhm,
Why is this the way it is? And what else could be causing this? There must be a blockage more
mhm,
superior. There must be a blockage more deep, like things like that. And vascular is pretty interesting because, like Lynn said, it's the whole body. People don't realize you
mhm.
can do the arms, veins and arteries, the legs, veins and arteries, as well as your brain. So we scan the brain, we do transcranial Dopplers, and I saw that Lynn has been learning how to do them. But
Yes, I
yeah,
practiced on myself.
yeah, and I'm sure, and yours look really good. Like you looks like you have a good window. A lot of people don't have good windows actually to scan their brain, but when you do have a good window, it's pretty cool to see. Um, and you can see, and you have to know which way the flow is going, if it's going above the baseline, below the baseline. So vascular is actually pretty intricate in itself as well.
Mhm.
And there's much more to knowing it than just seeing a tube on the screen. But yes, some people would say it's just following a tube in which direction the blood flow is going and seeing the way it's either pulsatile or the
Mhm.
phasicity of it, seeing how the blood is working, and then it connects back to the heart. So then
Yeah.
a lot of times people get echoes and they also get these vascular ultrasounds. And that's why it's good to know vascular if you also do echoes. But there are some vascular sonographers who don't know how to do echoes, like me. We send you guys off to the echo sonographers. So, but vascular, I really like. I like vascular a lot. So if you
Me
like,
too.
yeah, if you like blood flow, if you like directional, like trying to figure out like a mapping, right? Because we map veins, we try to figure out
Mhm.
which way it's going. If you like that kind of stuff, then vascular probably will be for you. And some people don't like it because of the types of exams we do. You're gonna have to see feet. Some people don't like looking at feet. So
Or disgusting feet.
yeah, because the blood flow, the reason why people
Mhm.
get like necrotic toes and necrotic feet and like wounds all over their legs, it's because of the vascular disease or symptoms that they have. And that's what you are going to have to do as a sonographer. You're going to have to scan around the wounds. You're going to have to kind of get down and dirty with vascular almost.
Mhm.
And a lot of times, the reason why you're doing a vascular is because they have swelling or pain. So I'm just warning you there. But I mean, I love
Yes.
vascular.
I do too. Like, I would say transparent, the grossness part of vascular, I'm okay with. Like, I've seen blood because, patient came in for a pseudo aneurysm check and they recently had a stitching there. And, when we scan, we put pressure, obviously it's going to bleed. And the probe was like bloody. That was my first time. I was just like, and
Yeah.
the and my preceptor was like, "Oh, yeah, that's fine."
Yeah. I
So
think
the second time I did it, I was like, "Okay, this is normal."
you're like, actually, okay. Yeah. I think that the most, like, the most, like, grossest, like you said, part of sonography will have to do with vascular.
Mhm.
And we deal with it. It's the medical field. So, but
Yeah.
then after that, I think the next probably grossest thing would have to be pelvics and vaginal things that we're gonna have to do with OBGYN. So, for some people, that's gross and they don't want to deal with that, and that's why they don't choose general. They choose echo or vascular.
I don't think that's gross. It's not for me.
Yeah, some people think it's gross, but also, a lot of times you don't have to do OBGYN that all day. That's some so when people think of ultrasound, they think of babies, right? And so
Mhm.
that's your general route. And your general route includes OBGYN. It's not just OBGYN. Transitioning now into general, Lynn does not scan general.
Not yet. I'm actually learning soon.
That's good because I know your program like has they
General and
yeah.
OB.
Yeah, so that's good. Like, at least she gets to learn about them, and
Yes.
if she gets hired by some hospital that ends up doing all 3, like, she can learn that too if she really wanted
Yeah.
to. And that's the good thing about ultrasound is even if you choose one route, you can still learn the other routes as well, or cross-train, vice versa, things like that. That's
I
gonna
really
be
like that it's very versatile.
yeah, that's for another conversation, but
Yeah.
it's definitely something that you guys can do. You can decide if you wanna go one route and still do another route. And I've seen a lot of you
Mm.
guys who wanna do that because you got lucky that they teach you everything about
Yes.
everything.
Yes.
But general has not only OBGYN, so babies and pelvics, but it also has thyroid, abdomen. So the abdomen scans include gallbladder, kidneys, and we don't just do like a full abdomen. We can just do just a kidney ultrasound or just a gallbladder ultrasound. That includes all the bile ducts, that includes pancreas, and then we have the prostate exam, and then we also have small parts, so like soft tissue, and then general also includes pediatrics. So general is basically everything else besides the heart and the arteries and the veins and the vascular stuff. So do you have any questions about general since
Um, I don't have any questions because what you're about to say is what I'm gonna take in and bring it with me to when I learn general.
Yeah, yeah. So I mean, it's a lot of stuff. We also do procedures. So we do things like drain fluid from the belly or drain fluid from around the chest. We also do biopsies. So do tissue sampling. We do fine needle aspirations. So we kind of drain little collections like behind the knee, on the knee, in the leg, anywhere. We can drain anything really. And then in OBGYN, we also do 2 other exams that people are probably more commonly known. When you have a miscarriage, they do go into the vaginal canal and they clean out the uterus and the endometrium. So that's called a DNC, or they also do a sonohysterogram where they put fluid into the endometrium and they check for polyps. And it's kind of cool because they are inserting fluid and you see the endometrium like expanding in live time, and then you can see if there's polyps on the walls of the endometrium. And general is a lot. It's a lot in itself. It entails a lot. And so that's why a lot of people go that route because there's so many different things. It's the whole entire body. It's anything from the head to the toe, really. And I do general vascular at my hospital. It's combined together, and then they have the echo department. It's pretty fun to do general just because you never know what you're going to get. You never know what you're going to see, and just like how there's a lot of pathology in the heart, there's a lot of pathology all over the body. Now, think about how much pathology there is just for the kidneys alone. Like, just for the kidneys alone, just for the liver alone, Then you gotta include the pancreas, the spleen, and the bladder, prostate, the thyroid, testicles, ovaries. That's a lot, isn't it?
That's so much.
But it's fun, and if you go to general, you're gonna learn all that stuff. It seems almost like people ask me, like, "How do you study for it?" It's just so much, like, for abdomen in general, like, it's so much because there's so many different organs, and I tell them to, like, just break it down organ by organ, and you'll see that everything comes together, everything works together and everything has similarities. So just like how you can have cysts in your ovaries, you can have cysts in your kidneys, cysts in your liver, just like you can have masses in your liver, you can have masses in your ovaries. It's all very similar, just different parts of the body. And that's what our job is to do is investigate, find the pathology all over the body, write a report and describe it. And I'll tell you, it gets difficult when there's more pathologies because you're looking at the liver, then you're looking at the spleen, gallbladder, the kidney, the bile ducts. You're looking at everything in one setting, and that's what keeps, I think, general very interesting. You're always thinking, you're always searching, and like Lynn says for echo, like seeing it live time is pretty cool. Like you get to see it right there on the screen, and you know what's happening. And sometimes you don't know what's happening, but you see something that's abnormal. You're like, oh my gosh, what's that? And you take a picture of
Yeah.
it. And that's what sonography is all about. And hopefully this kind of gave you guys a little bit of an insight into all three modalities, so echo, vascular, and general. And we just wanted to talk about each three just so you guys can decide like which route you want to go and what interests you more. And like Lynn said, she as she learns as a student, she can see what she likes more. Now for me, I learned vascular first. I learned veins first and then arteries and then abdomen. Gradually, I liked vascular first and then abdomen last. So obviously, I'd rather do vascular than abdomen. However, I do it all. So it's really cool to be able to be that versatile. And I can work really anywhere that does abdomen, general vascular. And so hopefully one day I learn echo, but I don't know. Maybe you can teach
You
me.
should. You should. Echo is really uh complicated, but then the human body is like so complicated. Just listening to you talk about general, I can finally understand. I have classmates who are in a different cohort, same cohort as mine, but different was it track that are in the general track. And I
Yeah.
remember last year some of them saying, "Oh my god, abdomen is killing me because it's so much information and they were overwhelmed." And now I can understand why.
Yeah, and people don't realize they go into ultrasound, right? They think of babies, and it's way more than that. Now think about when you do the full abdomen in an adult, right? Or we're
Mhm.
scanning an adult. Everything can be related to pediatrics. So everything you learn in adult, you can do in pediatrics. There's a few more exams in pediatrics than there are in adults that we do. However, now you think about all that in a baby, and then you think about it as a fetus, right? So that's why there's fetal sonography, so fetal echo or fetal sonography in OBGYN, and then there's pediatric sonography. So when you're after you're born, there's neonatal, like the period right when you're born, and then there's pediatrics all the way up to your 17, pediatric echo, pediatric sonography, and then you've got adult sonography. So there's sonography for all ages, all types. When you go into this field, you're going to scan from age 0 to 100. I've had some patients that are in their 90s, 101, 102. So you're going to be scanning people all their lives. And for a long period of time, we hope that you guys really do enjoy doing ultrasound because I think ultrasound will be here for quite some time now. Even with technology, we're
It'll be
still
here
growing.
forever.
Yeah.
Oh, it's just gonna grow and it'll be here forever. And I just thought of something about abdomen. Um, the hard part about abdomen for me is the biogas.
Oh, yeah.
That is
Yeah.
so tough. I was like, I don't know how you do it, how general sonographers do it, because everybody's different and
Hmm.
biogas is there. Like so you have to learn how to
Yeah.
navigate it. You have to learn, even if patient says they didn't eat, but you clearly know they ate.
Yeah, exactly. And just like echo, if you gotta find your window, right?
Hmm.
Like,
Yes.
so you've got your windows for echo, you've gotta find your windows for abdomen, and there's multiple windows. There's not just one window. So people think, like, they can just, like, okay, you can find your pancreas here, epigastric region, right?
Mhm.
And they just think that's the like, you put your camera there and boom, you should find the pancreas. No, it's all about angling up, down, moving left to right. Everyone's body is different. Everyone's pancreas may sit in the same area, but there's bowel gas in the way, like you said. Some people have large livers, some people have a very tiny pancreas, and some people you just can't see the pancreas at all. And that's where
Mm.
general sonographers have to deal with, okay, do I just put area or do I fight so hard about like pushing this bowel gas and getting that out of the way? And those are the things we have to deal with every day.
So
But
it doesn't make it boring.
no, it doesn't make it boring.
Never boring.
Lots of critical thinking and decision making in this field. So I think regardless which route you choose, which track you go into, I think you're going to be okay. I think no matter what, you can learn a lot from each modality and each track, and eventually you can even learn more. And I think just getting into a program is such an accomplishment in itself that
Agree.
eventually you'll learn. And once you get your hand on your probe, you can still see in the future, like people will be willing to teach you other types of exams. And when you go to work, they're going to be like, "Oh, do you want to scan this?" Like even if you work somewhere else and you didn't know how to scan something, sonographers are so willing to teach, I feel like, and help each other out. So yeah, definitely get your research on, figure out which track you want to choose, which interests you more, and kind of start from there, I think.
I totally agree. I hope this episode has been very helpful in guiding you to which specialty you want to go in. And just don't forget, whichever you choose, you can still learn another specialty. So you're not
Yeah.
sticking to just one.
Yes, and we'll definitely kind of go into more deeper episodes, I think, with each track, so we can just focus on each one individually. That way, you guys can kind of see more, and I especially when Lynn graduates, we'll see where she's at and see what she becomes a pro expert in,
You never
and
know.
and we never know. What if you end up doing general? No, I'm kidding.
No, right?
You never know. But with that being said, we hope you guys enjoy this episode, and we'll see you guys on the next one.
Yes, thank you.
Yes, thank you. Bye.
Bye.